When Kea was young, there were some bullying issues that were very significant. In fact, someday I'm going to throw it away. I'm not far enough yet, but I still have the letter that some of her fellow students wrote to her in the 7th grade asking her to kill herself. It's horrible. And Kea went through a rough patch. And one of the things I want to be clear in this interview is Kea is not a victim. There's no one that should look at her. You shouldn't feel sorry for her. But it was a learning experience, and it was an experience that as a family, we grew closer together.
I think I was about like 9 or 10. I started like self-harming, and I didn't know how to get help. I didn't know how to ask them for help because I felt kind of shameful. Like, my dad's right. My life's perfect. No one should feel bad for me. I have a really, really good life. And so I was like, okay, I'm feeling really sad. And I don't know how, like, I shouldn't feel sad. I have a lot more than I could ever ask for, and I'm really grateful for this. So why is this happening to me? How come I'm feeling this way? And then it was around this time my mom actually walked in on me, and she just broke down and she said, Kea, how can I help you? I didn't know this was going on. How can I help you? And they were talking to me about going to a hospital because at that time, what are you supposed to do? That's just what you did. And then we have a really good family doctor, and he told us of a really good counselor or psychologist in Twin, and I'm actually going to see her tomorrow. I love her. And ever since I was 10, I've been going to her, and I think a lot of people misinterpret therapy. Therapy is not going to make your life easier. It's not. Honestly, in some cases, it's going to make it harder, which is a good thing, because if it's harder, that means you're trying. In my own personal way, it took me probably about 3 or 4 years before I decided that I wanted to change and I wanted to make myself feel better. And I was going to therapy every week or every other week during those 3 years.
Those were some dark days.
Yeah, it was not good. And I still struggled with it. It went from, I didn't know how to cope with it. It went from self-harming to an eating disorder, back to self-harming to an eating disorder, to my life's chaos, and I have no idea what I'm doing, so I'm doing both. And the school system had a really, a huge impact on me. When I tried killing myself, I want to be very clear. When I tried killing myself, I did not want to die. I did not want to die. I didn't know how to get help, and I didn't know how to explain how I was feeling. And at this point, I was already going to therapy for 2 years. And it wasn't until about then that I decided that I was going to get better.
One of the things we learned is once you get so deep into this dark place, you actually make it darker yourself. You feed into this. And that's where having someone who can help you understand where you're at and how you got here, but also how to get you out of it without self-harm or without beating yourself up. That's why it's so important. Comes a point in time when we've, so to speak, turned off the lights, it's getting dark, and then we cover the windows, and then we pull a blanket over our head, and then we put a sack over our head, and we just keep feeding this victimization and this downward spiral of mental health. And that's where the health professionals come in. That's somebody has to reach into that deep hole you put yourself in and help you come out of it. Sorry. We have been to the bottom, okay? We have been to the bottom, and we have hugged each other and helped each other and gotten help. And now life is life, and there's still bad days, but we're learning to cope, and we cope together, and we cope with each other, and we want other people who are struggling with this to know that there are better days ahead, and the missing link for you is getting the professional help you need.